In a few words, describe the United States healthcare market today. I have a follow-up question for this, I promise.
I'm trying to think of a word that's appropriate for this audience.
Yeah.
Honestly, our healthcare system is damaged. It's fractured. It is. I'm embarrassed by our healthcare system.
And I asked this because I was curious as to, in talking to you in the past, how does a small business owner navigate an industry in the U.S. that is dealing with its own challenges across the board?
That's a fabulous question. I think all of us as small business owners are struggling with that. I do think that some of the things that are coming up lately, I actually spoke at a different conference and someone argued with me about this, which is fine. But I do believe that the more we can put some of the expense onto the people receiving the care, the better our healthcare system will become. And right now, I think that insurance has really hurt us because people are making decisions. They don't think about value in healthcare because it's just a copay, and so you really don't know what you're getting. It's also extremely hard right now to know whether you're getting something good or you're getting something bad, because a lay person, and even frankly a non-lay person, has a hard time determining what is actual quality in healthcare. So a lot of employers are working with brokers to design health plan design is something that we can use to combat some of the issues that we're having. There's definitely been a lot of really great studies that show that limiting networks, providing a very strong primary care base for your employees, but not having like a huge broad spectrum of specialists will actually decrease your healthcare costs. So a lot of people are working really hard on plan design. The other thing that about plan design is the pharmaceutical costs, which are astronomical. And there is, I talk about this all the time. There is absolutely no regulation of the pricing of drugs in the United States, and in other countries they've actually set margin limits so that there is a little bit of an ability for people to not, because the thing that I say all the time is, what would you pay for a drug that could save your life? You'd pay anything that I asked, right? I mean, and so I think that we take advantage of that in our country. We take advantage of people who are desperate for the therapies that we provide.
How do you stay in front of an industry that at times can be a political football, is constantly dealing with new technology, trying to work its way into an industry, and also is dealing with new players? I mean, you have major hospital systems trying to get into an urgent care market as
Absolutely.
well. How do you stay at the forefront of this industry?
It's almost, I read Joe Martin like every day. It's ever changing. There are, right now, what's happening in healthcare is there's more consolidation. So there's bigger healthcare systems, and there's a lot of physicians owned by healthcare systems. And so what's happening is it's becoming a 2 to 5 player in every big marketplace, instead of what it used to be was all private. Everybody was kind of doing their own thing. And so what that has done, besides drive up the price, is that it has changed the game for those players that are left to how can we get the patients as far upstream as possible. So what I mean by that is that urgent care now has all of a sudden become a very valuable asset to a healthcare system, because we see patients who don't have doctors. So, if you're a healthy person who doesn't need a doctor, and you hurt yourself or you get ill or you start feeling bad, many of our patients will just walk in and because they'd rather just walk in and take care of it. Well, we diagnose quite a bit of chronic illness. You come in and you think you just have a little flu, but it turns out you actually have diabetes, or you have thyroid condition, or you have high blood pressure. And then all of a sudden you need a doctor. Well, in our practice, we refer our patients who need chronic care to a primary care provider. Well, when we're the ones that are determining whether that patient is going to go here or go there, all of a sudden people are really interested in us. So that's been a kind of a fascinating shift that's happening. Everybody's trying to figure out how do we get the patients who haven't decided which healthcare, the undecideds, they want to grab the undecideds. And so I think that's happening. I think also there's been this huge talk, there's so much talk about ACOs, these accountable care organizations, keeping patients in a network. The big buzzwords of patient-centered medical care and medical home. These are it makes me laugh because I think what we do is we have the same ideas and we just keep renaming them and presenting them as something different. But a lot of this stuff is just like the HMOs of the olden days, is like the ACOs. You're kind of limiting the network and keeping them in, and the patient-centered medical home. Honestly, that's really what care was supposed to be in the first place. The primary care person being the hub, and then consulting different people for the patient's care. So.
What does this do to a next level? Do we see acquisitions? Do we see mergers? How does that happen?
I don't think that a week has gone by since I opened Next Level that I have not gotten a call from a private equity firm or another urgent care or there's some investment bankers. They want to
the ones that all told you no.
The ones that all told
yes.
Years ago. Now they're like, hey, but it's been it's been weird because I've never been in a business like this. Nobody was calling me saying, hey, can we buy your orthopedic practice? Nobody did that. I had to go out and sell it. This thing is crazy, especially crazy in that it's a really low margin, kind of a terrible business. I mean, if you really want to get down to it. I mean, I love it because it's challenging and I feel like I'm doing something good, but I'm not really sure I understand it from the standpoint of big business, except for what I just told you, which is that value of the patients, which is not a monetary value. It's not I can't put that down on a balance sheet, but it's pretty valuable. So that's been a little weird. I don't want to sell it because my experience has been that when I sell something, I just want to get into something else. I'm really having fun and I like it, and I want to keep at it and make it what I kind of bring it all the way to the vision that I had for it. But having said that, I experienced the health world changing, or basically, just the world changing.
Yeah.
And so, I have sold a business that I never thought I would sell in the past. So I think it's nice to have a lot of options, and certainly, it makes you feel like you're the most popular girl at the dance. But it doesn't really help me right now.
Yeah, absolutely. What's the best piece of advice you would give for somebody in your position, or who was in your position, who is either in a company, a Fortune 500, one of just another 1,000, or maybe a doctor who has an idea? What would you tell that individual about going out on their own?
I talk to a lot of people with ideas, and I hate to say this because I know I see the brokenheartedness, but an idea is just an idea, and there is a huge gap between having a great idea and executing and having that come to fruition. And so I tell a lot of people that there has to be this burning desire to basically kind of have a crappy life in terms of like, you got to throw your whole soul into it. If you don't feel that need to just be really, just be really involved, I don't think, I just haven't met that many people who've had successful businesses that they just dabbled in, or that they just, I had a great idea and the next day it was a really great business. I know people who just blood, sweat, and tears to build what they love, and so I think I don't need to tell this room because it's a different kind of room. But if I'm talking to somebody who's never built a business before, that I generally tell them, I'm not trying to dissuade you. I'm just telling you that if you think that this is just going to be just this meteoric ride and it's all going to be fun, then don't do it. So.
And then the last question I have for you: what is the most important thing you think today America's CEO needs to be doing, either for their business, for their community, for their industry?
I'll tell you what my biggest. I'll change your question a little bit. My biggest challenge right now.
That happens more than you
I know.
expect.
I bet it does. My biggest challenge as a CEO, and I bet this is going to ring true for pretty much all of you, is finding talent and finding people who are great at what. I struggle with that every day. No matter how many interviews you put a person through, no matter how specific you are on a job description. It is so difficult to find people, and I hate to feel like an old person when I say that really want to work, and so I think that what I do a lot with my free time is I do spend time mentoring young people, because I think that as people who want to see America continue to prosper, we've got to instill some passion into sort of the younger generations that are coming up. In my own practice, I hire a lot of younger people, and I spend a lot of time developing them. We have what we call stay interviews, where we bring them in and we talk to them about what are your actual personal goals, what do you want out of your life, and this could be anybody from like the lowest person in our organization to someone in management. And I'm surprised at how many times people don't actually even have an answer to that. And I just always say you can't get anywhere if you don't know where you're going. And so anyway, I think that it's a responsibility that we all have to try to generate some excitement in our younger generations.
Yeah, absolutely. Let's put all the questions that we have. Does anybody have any questions in the audience that they want to ask? No? Well, thank you again to the tasting room and to VCFO, and also thank you again, Dr. Breeze.
Thank you. It's nice to be here.
Thank you, everyone, for coming, and we'll let everyone know when we have the next event. Like I said, feel free to have some more food, some drinks. Thank you very much, Dr. Breeze, for being here and being our
Thank you.
Cascade.